Hi, I'm Dr. Andrew Shanahan. I'm the director of the Cardiac Catheterization Laboratory and Coronary Intervention Program for the treatment of heart attack at Penn Medicine Princeton Medical Center. Today, I'm going to talk to you about elective angioplasty, a procedure that is used to open an artery quickly to restore blood flow to heart muscle. Angioplasty is performed through a minimally invasive procedure under moderate sedation that aims to keep the patient comfortable. During the procedure, an interventional cardiologist will insert a small, thin tube called a catheter into the artery. When the catheter is inserted, it's carefully maneuvered into the clogged artery on the outer surface of the heart. The physician uses advanced technology and a high-definition screen to ensure precise placement. Once the catheter is in place, a tiny balloon is inserted and quickly inflated and deflated. This pushes the cholesterol-filled plaque that's blocking the artery into the artery wall, clearing the blockage and improving blood flow. In most cases, a tiny metal cylinder or coil called a stent will also be placed during the procedure. The stent contains a medicine on its surface that helps prevent the artery from being blocked again in the future. Angioplasty can be performed in an emergency setting during a heart attack. It can also be performed as an elective procedure for those who are experiencing heart disease-related symptoms. You may be a good candidate for elective angioplasty if you have a significant narrowing or blockage of a coronary artery, or if you have symptoms of heart disease caused by a hardening of the arteries. Heart disease symptoms can include chest pain or discomfort, also called angina, shortness of breath, extreme tiredness, dizziness, swelling of the legs. Your physician may recommend elective angioplasty if you've had a heart attack, have significant narrowing or blockages of your coronary arteries, have had an abnormal cardiac stress test, have a heart rhythm disorder, if you're not feeling better despite medications and lifestyle changes to reverse hardening of the arteries. Also, if you've had a coronary artery bypass graft to treat a new blockage or narrowing of one of the coronary arteries that has been closed. Your doctor will review your symptoms and health history to determine if elective angioplasty is your best option. The majority of patients recover quickly from elective angioplasty and experience improvement in symptoms such as shortness of breath, tiredness, and angina. As with many procedures, there are risks. However, the risk of complications, most commonly bleeding at the incision site, is low. Most patients go home the same day or the next morning, and recovery time at home is minimal. And most patients find they can resume their normal activities within a week after the procedure. Having an elective angioplasty doesn't mean that your heart disease goes away, however. You may need medication and to make lifestyle changes to improve your heart health. For instance, after a procedure, your cardiologist may prescribe medications such as aspirin and aspirin-like blood thinners to help keep the stent open. Your cardiologist may also prescribe medicines to manage your cholesterol level and to help regulate your blood pressure. You may also be advised to make lifestyle changes to help prevent future heart disease, such as quitting smoking, eating a healthy diet, and becoming more active. In some cases, your doctor may recommend a cardiac rehabilitation program to help you learn how to live a healthier lifestyle and manage your long-term heart health. For patients who are good candidates for angioplasty with a stent, who take medicines provided by their doctor and follow other heart health recommendations, there's a slight risk, just under 10%, of the treated artery becoming clogged again. Following an angioplasty, most patients continue under the care of their primary care physician and a cardiologist to regularly monitor their blood pressure and cholesterol and to help maintain overall good health. Princeton Medical Center's cardiac care program offers a combination of advanced equipment and skilled medical professionals. We provide comprehensive cardiac care from cardiac catheterization to emergency angioplasty. We also offer cardiac testing, including advanced echocardiography and rehabilitation. Princeton Medical Center was recently rated high performing in providing care for heart failure by U.S. News & World Report. If you or a loved one is suffering from symptoms of heart disease or shortness of breath that interfere with daily life, speak with your primary care physician or cardiologist about the benefits of cardiac catheterization and possible elective angioplasty.